In 2009, the Minneapolis Department of Health and Family Support partnered with community organizations to launch the city's most ambitious, comprehensive effort to reduce obesity and tobacco use. Together, with funding from the statewide Health Improvement Program, also known as SHIP, we set out to improve access to healthy food and increase opportunities for physical activity and smoke-free living, where Minneapolis residents live, work, learn, or receive health care. 2 years and a lot of hard work later, we have many successes to celebrate. Minneapolis made 18 plots of city-owned land available for community gardens and passed an urban agriculture policy plan that sets the stage for urban food production. The owners of 8 convenience stores joined the Healthy Corner Store program, improving quality and affordability of fresh fruits and vegetables, and increasing produce sales as much as 50%. Thanks to PICA Head Start, more than 2,000 children now eat more fruits and vegetables at meals and snack time. 4 farmers markets took on the challenge of offering EBT, giving recipients of food support access to locally grown fruits and vegetables. After piloting a healthy vending program, the Minneapolis Park and Recreation Board developed a comprehensive, system-wide food policy that will apply to vending, concessions, and all youth programming. Because of efforts of CAPI and Common Bond communities, 2 low-income housing properties started on-site mini farmers markets that provide fresh produce to more than 1,500 residents during the summer. 19 volunteers became trained through the Food Preservation Network to teach canning and coordinate community can-alongs, where community members collectively preserved hundreds of pounds of produce. And that's not all. Resources for Child Caring train providers from half of all licensed child care programs in Minneapolis to improve their physical activity and nutrition practices. Despite shrinking budgets and competing pressures, half of Minneapolis charter and alternative schools increased the quality and quantity of physical activity for students, helping their students to be more active and focused on learning. Minneapolis Public Schools implemented a comprehensive, nationally recognized Safe Routes to School initiative that increased biking and walking at 22 schools. Thanks to Commuter Connection and the Bike Walk Ambassador Program, 9 worksites offered programs, incentives, and supportive amenities to increase bike commuting among their 8,000 employees. Little Earth of United Tribes started a bike sharing program for its 900 residents. 6 other housing properties implemented similar strategies to help residents be more active. WellShare and CAPI worked with management at Riverside Plaza and Glendale Townhomes to designate some buildings smoke-free, reducing secondhand smoke exposure for hundreds of residents. 9 clinics and Park Nicollet Health System put systems in place to improve clinical care for obesity. As a result, they have dramatically increased measurement, counseling, and referrals for patients who need weight management and smoking cessation support. Combined, these clinics provide 100,000 patient visits each year. Even young people work to create healthier environments. Armed with cameras and critical eyes, 7 teens joined the Photo Voice Project and captured powerful visual indicators of health in their communities. To instigate action, their photos were displayed at City Hall and the housing properties where they live. As the first phase of SHIP comes to a close, CPPW-funded partners are continuing to create healthier environments through initiatives such as a new bike walk center, an expanded Nice Ride network in North Minneapolis, new local garden resource clusters, enhanced safe routes to school, as well as through the Bike Walk Move and Making It Better campaigns. Because of us, our collaboration, our hit-the-ground-running spirit, and the investment of SHIP, more than 225 Minneapolis settings are healthier than they were 2 years ago. Because of our efforts, tens of thousands of adults and children have better access to healthy food and opportunities for physical activity and smoke-free living. Over time, the transformative, sustainable changes that we accomplished together will reduce obesity and tobacco use and will help residents live longer, healthier lives.